Shmai Dyfrig, this is Steph from Surgery App. I know we discussed a while ago the issue you've got with blood pressure and blood pressure monitoring in practice. So I've had a good think about this, of how we can sort of help practices out with this. And I've come up with a sort of idea, really. So I'm going to share my screen now and make this a full screen. So actually, I'll put myself at the bottom here. So you can see on this page now, this is something we built for Hywel Dda Health Board. We'll choose English for now. This is a website we built for Hywel Dda Health Board, all around malnutrition. So they've got a big push on malnutrition in the health board. And there's information here, obviously bilingual. This is what we built for them. But we built a tool, an online self-screener tool, so the patient can access a tool. They can put in, I guess, put in some parameters here now. 13 stone, my previous weight was, actually we'll show you. So if I say I've lost a bit of weight, I'm down to 11. My previous weight was 13 stone. And I am 5'9". If I continue, then there's some more questions that I'm being asked here. I'll click no to and say yes to one. Then it'll kick out a result. So that clicks out the result and it gives the patient information as to what they should be doing next. So having thought about this, really, patient information videos are really sort of powerful for patients. So I know the NHS, NHS Digital in England, they have a BP tool, but all that really does is it tells patients, they put their BP reading in, then it gives them a result, and it says what category they're in. What I thought we could do with you guys is look at something similar to the tool on the website we built for Hywel Dda on malnutrition, but then to have educational videos for patients when it kicks out the result. So if the result is normal, it gives the result as a normal result from there. If it's abnormal in any way, and I know that BP results can change now on age, I think that's right. And then the result it gives to them, it can give a package of care, really, so that if it becomes slightly abnormal, then it gives them advice of what they can do. But through a way of a video and some resources they can download, just as education and assurance for them that they don't have to then come to a GP. If it's greatly abnormal, we can then submit that. It can say, okay, well, this is the result. It is now abnormal. This is what you need to do, and they can submit that result to the GP. Then the form, we could also build it so that anybody who is putting a BP in there can also, if required, submit that result to the practice, so that it can be coded into EMIS Vision or System 1 if it does come into Wales. And then you've got that record of BP, which I think you mentioned you were missing about 10% of your population not having a BP result. So I think that's what we could do for you. We could build a really good resource around BPs, an educational resource for patients, so that you can pick up those BP readings. But for those patients who don't need any further intervention, then they just get reassurance. But for those who do need intervention, whatever that may be, we produce educational videos, of course, bilingually. We've got a bilingual presenter for you. So that it tells patients what they should be doing next, how they can help themselves, and what intervention will happen next from the practice. So I thought it would be easier to do this on a video for you, rather than putting it in by email, and show you visually what we've done in Hywel Dda on malnutrition, and what we could replicate for you guys as well. So welcome your thoughts on this, and if you want to discuss this more, then more than happy to jump on a call or a phone call. Okay, diolch yn fawr. Diolch.